Welcome, let's talk about something very important, our hearing. Hearing connects us to the world. We use it to enjoy music, hear birds sing, and listen to loved ones. As we age, our hearing naturally changes. This is perfectly normal. It happens to almost everyone, but it's important to understand these changes. We can then take steps to protect our hearing. We can also find ways to live well, even if our hearing declines. This journey starts with knowledge. Let's learn more about hearing loss and aging. Inside our ears are tiny hair cells, which play a crucial role in our ability to hear. These cells pick up sound vibrations from the environment and send them as signals to our brain, allowing us to interpret different sounds. As we get older, these hair cells can get damaged due to various factors. This damage happens gradually over time, often without us even noticing it at first. Think of it like a favorite sweater that you wear often. With time and use, it can become a little worn and frayed. Our ears are quite similar in this regard. Years of exposure to loud noises, certain medical conditions, and even genetics can contribute to this wear and tear on our hearing. This age-related hearing loss is called presbycusis, a common condition among older adults. It usually affects both ears, making it harder to hear high-pitched sounds and understand speech in noisy environments. It also tends to worsen over time, gradually reducing our ability to hear clearly. The good news is that this gradual change allows us to adapt, and there are various ways to manage and improve our hearing health. How do you know if you are experiencing age-related hearing loss? There are some common signs. You might have trouble hearing high-pitched sounds. Women and children's voices might seem muffled. Conversations in noisy places can be difficult to follow. You might find yourself asking people to repeat themselves. Or you might turn up the volume on the TV louder than others prefer. These signs can be subtle at first, but they are important to notice. If you experience any of these, talk to your doctor. Section 4. The impact of silence. Silence can be more than just the absence of sound. It can be a profound experience that shapes our lives in unexpected ways. Hearing loss can impact our lives in many ways, often in ways we don't immediately recognize. It can make it hard to communicate with loved ones, which can lead to misunderstandings and frustration. Simple conversations can become exhausting and emotionally draining. Social situations can become challenging, and you might feel left out of conversations. This sense of exclusion can be deeply isolating. This can impact your emotional well-being and mental health. Feelings of loneliness and depression can become more pronounced. Some studies even suggest a link between untreated hearing loss and cognitive decline. The brain struggles to process sounds, which can affect memory and thinking skills. Hearing loss can make it harder to stay engaged and active. Activities you once enjoyed may become less appealing. The good news is that there are solutions. Modern hearing aids and other assistive devices can significantly improve quality of life. Addressing hearing loss early can make a big difference. It can restore your ability to connect with others and enjoy social interactions once again. Section 5. Turning up the volume. Hearing aids are a key solution for age-related hearing loss. They help people regain the ability to hear clearly, which can significantly improve their quality of life. Think of them as glasses for your ears. Just like glasses correct vision, hearing aids correct hearing. They amplify sound, making it easier to hear. This is especially helpful in noisy environments where distinguishing sounds can be challenging. Today's hearing aids are small and discreet. They are designed to be comfortable and barely noticeable. They come in different styles to fit your needs. Whether you prefer in-the-ear or behind-the-ear models, there's an option for everyone. Your doctor can help you find the right type of hearing aid. They will consider your specific hearing loss and lifestyle needs. Regular hearing checkups are also important. These checkups ensure that your hearing aids are functioning properly and that your hearing hasn't changed. A hearing test can determine the extent of your hearing loss. It provides a baseline for your hearing ability. It also helps to rule out other medical conditions. Sometimes hearing loss can be a symptom of a more serious issue. Don't wait until hearing loss becomes a major problem. Early intervention is key. Addressing hearing loss early can prevent further deterioration and improve your overall well-being. Section 6. Clear communication. Living with hearing loss might require some adjustments. Here are a few communication tips. Find a quiet place to talk. Background noise can make it harder to hear. Face the person you're speaking to. This allows you to see their lips and facial expressions. Don't be afraid to ask people to repeat themselves. Most people are happy to help. Let people know you have a hearing impairment. This can prevent misunderstandings. Remember, communication is a two-way street. By being patient and proactive, you can continue to enjoy meaningful conversations. Section 7. Living well with hearing loss. Hearing loss is a natural part of aging for many people. It's important to remember that you are not alone. By understanding the causes, recognizing the signs, and seeking solutions, you can manage hearing loss effectively. Hearing aids, regular checkups, and simple communication strategies can make a world of difference. Don't let hearing loss hold you back from enjoying life to the fullest. Embrace the sounds of your life and keep those connections strong.